Do you have a true hernia or do you have a sports hernia? For those of you who are new to my channel, my name is Alexander Kravich. I'm a physiotherapist in Vancouver, British Columbia. Today we're going to be asking the question, do you have a real, true hernia or do you have a sports hernia? Let's get right into it. So first of all, let's define some of these terms. So a true hernia is when there's actual abdominal contents that are protruding through a weak spot in your abdominal cavity and abdominal wall. There are different types of hernias. There's inguinal hernias, femoral hernia. It all just kind of depends on where the protrusion is happening, but there are various spots around your abdominal region that are susceptible to hernias. Then we have sports hernias or athletic pubalgia, which isn't actually a true hernia in terms of the abdominal contents bulging from a weak spot in the area, but it is actually an abdominal injury or a strain or sprain that can arise as a result of different sporting events or activities. Why am I trying to dissociate the two? Because it's important to know that the treatment for a true hernia, such as an inguinal hernia versus a sports hernia, are treated much differently. There's a couple different tests that you can do to determine whether or not you have a true hernia versus sports hernia. So number one is imaging. So individuals who may believe that they have a true hernia would get a ultrasound of that region, and then during the ultrasound, the technician would ask the individual to perform a Valsalva maneuver. So think about where you're bearing down, holding your breath, tightening up your abdominal muscles as if you were about to cough. And when you do that, when you're trying to increase the pressure around your abdominal region, the assessor is trying to see if there's a change in the diameter of the abdominal contents to see if it is protruding, because if there is an increase in the abdominal content diameter, then that may indicate a hernia. So that's one thing to look at, is imaging, such as a ultrasound in that region. The other thing to look at is we would ask the individuals to cough, and then as they're coughing, we would feel around the groin region and around the belly button region for any bulges or protrusions. So somebody who has a sports hernia, we would not feel for any bulges in the area when they cough or sneeze. It may be painful, but we wouldn't feel any bulges. Whereas with a true hernia, we would be able to feel for the presence of these bulges, and we would have our hands on both sides just to compare if there are any differences. And with a true hernia, you would feel the bulges and you wouldn't with a sports hernia. Last test is during our objective examination, we would look to see if there are any movements that are provocative or reproducing the pain that the individual is having. One of the tests would be a resisted sit-up test, where I would ask the individual to perform a sit-up, and then I would be pushing down on the torso towards the bed, and they have to resist that movement. And I'm trying to see if that's reproducing any of their pain that they came in for. The other test that we can look at is look at different hip movements. So movements like hip adduction, where you bring your hip towards the midline, or resisted tests of the various muscles around your abdominal area. And we're trying to see if that's reproducing their symptoms, the symptoms that they came in with. Because if it's not reproducing those symptoms, then it likely isn't a sports hernia. It's more likely a true hernia if it's associated with some of the other tests and findings that we chatted about before, or just a growing strain. There's a lot of structures in that area that tend to be a little bit more sensitive and where the symptoms can sometimes overlap. But we're looking to see, is it a muscular cause or is it an actual organ is protruding out of that weak spot? And the other reason why we say that is because individuals who have a true hernia, they can be treated with surgery, where they would basically try to install a mesh into that region to prevent the abdominal contents from protruding out, during day-to-day tasks. And obviously for some people they don't. It depends on how big the hernia is, how much it's affecting their day-to-day. But the treatment for a true hernia is much different than a sports hernia, where usually individuals who have sports hernia or athletic pubalgia, they typically respond quite well to physiotherapy and rehab exercise to try to build up their strength and their tolerance around the abdominal muscle and groin muscle region. And these are injuries that don't tend to get better with time on their own. They need sport-specific, exercise-specific rehab and active therapy to try to build up that tissue tolerance in that region. So there you have it. We went over 3 things to look for to differentiate between a true hernia versus a sports hernia. We looked at the presence of imaging or ultrasound, and then a Valsalva maneuver to see if there's any change in the diameter of the abdominal contents. we looked at the cough test, so asking individuals to cough and seeing and palpating for any masses, and if there is one, then it is likely a true hernia versus a sports hernia. And then the third one is just doing our objective examination at the physiotherapy clinic, where we run through different musculoskeletal tests of strength to determine whether or not it's a muscular injury, so a sports hernia, or if there is an actual abdominal injury, and as a result, of course, the treatment would be much different. So let me know what you thought about this video. Have you ever been diagnosed with a true hernia or a sports hernia? Let me know down below what your experience has been and what treatment you may have undergone to help with the condition. I have a few other videos where I go over some aspects related to sports hernia rehab and some exercises, in addition to just talking a little bit more in depth about sports hernias. So feel free to check that out if you found this content valuable. Consider checking out some of my other videos where I go over various physio, exercise, and medical related topics. Until then, we'll see you in the next video. Thanks for watching.